I think today is a very good day because we're here to celebrate something that we as a country have been able to do. And it's something that is moving us constantly towards the vision of what government has set itself to build a better Fiji. We cannot have a better Fiji if the people in this country are not healthy. And so we need to put in place the kinds of systems in the process that allows us to do that. So today is a great day. It's a celebration. It doesn't mean that we are completely free from the ravages of tobacco and its impact on all of us. And as you have seen from the evidence that has been provided, there is irrefutable evidence. You cannot refute this evidence that tobacco kills people. Everybody knows this. The tobacco industry knows it too. It causes harm, ill health, and death to users, even to those who don't use, who are exposed to the smoke. The most recent global school-based health survey in Fiji concluded that over 55%, that's over half, more than half of our children who are between 13 to 15 years old reported having adults smoking in their vicinity within the past week. That means it happens every week. Every single week, more than half the children in this age bracket. So to protect our children, we have to protect the areas in which people are allowed to smoke. Fiji has expanded smoke-free public places such as workplaces, markets, and retail shops through the Tobacco Control Regulation 2012 to complement the Tobacco Control Decree of 2010. Expansion of smoke-free public places has made a difference among adults. Between 2002 and 2011, the prevalence of non-daily smokers, which includes social smokers, has decreased by 7% among males to 19.9% and 5.9% among females to 8.3%. Furthermore, Fiji has expanded education and awareness programs about the dangers of tobacco use and secondhand smoke in schools with the support of the Ministry of Education's National Substance Abuse Advisory Council. Tax and price policies are widely recognized as among the most effective means of reducing demand for consumption of tobacco products. We continue to advocate for increased taxes on unhealthy products such as tobacco because it makes it less affordable and attractive to consumers. We appreciate the support of the Fiji Revenue and Customs Authority on increasing taxes on tobacco products each year. As we continue to expand the number of smoke-free settings and make the product less affordable, we provide further support to smokers to cease this habit. The Ministry has begun plans for establishing cessation services with nearly 100 of our nursing staff across Fiji trained to deliver brief tobacco cessation interventions. The Ministry will continue to build on our capacity to help people who want to quit. Fiji is the only Pacific Island nation that has signed the protocol to eliminate illicit trade of tobacco products, and will continue to take multi-sectoral action to prepare ourselves to ratify this very important treaty. Illicit trade of tobacco products is the production, import, export, purchase, sale, or possession of tobacco goods which fail to comply with legislations. Illicit trade can come in many forms, and I think one of the most common that we have in Fiji is selling rolls. Selling rolls or selling tobacco that does not have the health warnings. All of this is something that we will attack. As has already been pointed out, July is the NCD month for the Ministry, so media, we need you to promote this very strongly. Promote our theme. Don't delay, get checked today. Everybody in this room has been checked recently? You must all get checked. You must all get checked. I tell you, I went and got checked today for a number of things. That's a part of another program. Tobacco use is one of the 4 risk factors in NCD. Smoking, nutrition, alcohol abuse, maybe Angona abuse too, and physical inactivity. It is therefore fitting and most appropriate that Fiji is recognized for trying to reduce and eliminate smoking as a cause of many premature deaths. We are asking adults over the age of 30. Everybody here over 30? Yeah, all of you, eh? So all of you, you've got to get checked. Get yourselves checked if you have not already done so. It is always good to know the truth about your health. I'm happy and I'm proud of the ministry's tobacco control efforts, but we must keep in mind that it is not only the government that has a role in combating illicit trade, it is also you and me and our communities that have a role. I think a lot of us walk past in our communities where people are selling cigarette rolls and we don't do anything about it. We really have to do something about it. Somebody needs to talk about it. We can't be complacent about these things. Don't sell or buy single cigarette rolls. Don't smoke in a smoke-free place, and have the courage to remind someone if they are smoking in a smoke-free zone to take it elsewhere. You have a right to tobacco-free air. I am hopeful that as a result of this award, that it will spur us to even greater heights, so that we can rise to a situation we have far less people. And I'm speaking to you as a person who smoked for a long time in my life, trying to reform and get out of it, and I think I'm getting there. But that's the message that needs to go to everybody. A message that is important for NCDs. You can't achieve a better life against NCDs if we don't cut out smoking. So it's a great challenge for us. So NCD month, let's all go out there, preach this. Congratulations to everybody who has had a part to play in allowing us to win this award and making sure you get checked this month. Pinawalyo.
I am pleased to now call upon Dr. Liu and Dr. Ada to present the award to the Honorable Minister for Ministry of Health and Medical Services.